So here we are with Trudie. She's ready to start her procedure. We've drawn out a few landmarks on her face while she was sitting up, so we know exactly which direction we're going to go. These are called vectors of lift. So we're going to be lifting up onto the gel and then retracting back on the neck just under the jawline, so she gets that lovely jawline back again. Now Trudie's got good volume in her face, so we will find that when we lift here, it'll improve the mid-face fat pad as well, so that will support it. We're not using a scalpel for this sort of lift. We're going to use a needle, and we just go in with a tiny needle hole just into the skin, and then I do a little track that way and that way. Because I've anaesthetized this, Trudie should not be feeling any of this sharpness. No. Good. I'm going to place the actual suture into the hole. We've got a little marker here. I'll show that. There's a little marker which marks the depth that I'm going to go to. And that is the right depth, so we're just under the skin, in that little fat layer where all those little fibrous bands are. And I'm just advancing that gently towards the exit point, which we've marked out. There we go. And here we come, out to the other side. Now Trudie, you're going to feel the actual thread go through. Because we've got cones, you'll feel them go through the tissues in your skin. Can you feel that?
Slightly.
You'll hear some clicking as well.
Pain.
No pain there, that's good. Then pull up in the opposite direction. There we are. Just guiding it through under the skin, very gently. And now to that point which we've marked. Here. There we go. That's the suture coming out. Going to then guide that through this way. Again, you're going to feel it go under the skin. That's one fell out. Thank you very much. For aftercare, we're going to use some Fusidin, which is an antibacterial cream, just on these twice a day for about 3 days, just to prevent any risk of infection. Okay. This goes in the opposite direction. There we go. That's this side done. Thank you. So we've got little whiskers because we can adjust that, but we're halfway through now. We've done this side of the face, and I'll be cutting the whiskers off right at the end because I want to balance it off with the other side of the face. So what I'm going to do now is sit you up in a minute. We'll have a look and see how that's looking. Great, so now we've finished both sides of the face. I've completed the left side, and we can see that the mid-face is being held up beautifully, which highlights the eyes. And what we always want to do is frame the eyes so they look much better.